July 14th.
So move.
A second.
Okay, all in favor?
Aye.
Aye, great. There are no appointments on the agenda for tonight, and Health and Human Services has a total of 9 resolutions. 4 from Department of Social Services, 3 from Office for Aging, 2 from Mental Health. None, in my opinion, seem particularly controversial, so I think we could just, if we want to try to get through the resolutions or go with the reports. I know the Health Department has no official resolutions tonight, but do you have anything to add to your report, Kathleen?
I do have a few things when you're ready.
Okay. Okay, let's start then with the Human Services resolutions, if you don't mind.
Okay.
Actually, I think we can kind of group HH 1, 2, 3, and 4 together and go over them and then get a motion. And then if there's any questions, we can do it. HH 1 really is to fill a 100% funded Human Services Social Welfare Examiner in the Medicaid unit, correct? Principal, and it's a budgeted vacancy and it's fully funded.
It's fully funded. This is, we're doing this because our supervisor of the Medicaid unit is leaving after 30 years. And this will give us about a 4-month window of a crossover training period. And we think that'll help to set us up in a good position for when she leaves.
And as long as we stay below the Medicaid cap, then we
Yep,
have the
we're good.
funding to do it.
Yep.
Okay.
So that's HH 1.
And it's a create only because you're bringing the person in now prior to the retirement.
Correct. And then when the the veteran employee retires, that position that she's
Becomes-
will be vacated, will be abolished.
Okay. So there'll only be one principal.
Correct.
Okay.
In the end, at
Yes.
the end of December.
HH 2 is on a temporary leave bank for a department staff or employee.
Yeah, we were approached by the employee about, the potential of a leave bank. She is out of time and this would help her, getting through this tough time that she's having right now.
Okay. HH 3 is to enter into a contract with CAP, which is the contract has been in force for a number of years. It's being supported for the HEAP program, and it is 100% funded contract with Cayuga action program.
Correct. And they do all of the outreach for folks that are applying for HEAP, calling with questions. They process a ton of paperwork for those months that then, we bring into the department and pay the vendors. Very helpful.
And HH 4 is to renew an annual contract with Northwoods to support the software technology that the child welfare or the caseworker staff all use.
Mhm. Yep, all the caseworker staff have the capability on their mobile devices to use this program through the Northwoods company. It's called Traverse. Helps them to be able to have all their paperwork handy, applications, referral forms, much more efficient out in the field when they have this. We've had it for, I think, it's either 4 or 5 years. And so this is a renewal after that first term. Very, very helpful.
Ask a question before we go.
If we get a motion in a second, then we can ask a question. How about that? Okay, a second for these. Okay, now questions?
No?
Yes?
Okay, Christine, HH 2, keyword there is employee. And I guess I want to know if we have or thought about a shared temporary leave bank.
If I've thought about it, well, if the county.
Anybody, yeah.
I don't know if the county has entertained that before. Maybe, I'm not really sure.
I don't need a shared leave bank meaning.
That employees would contribute to a bank that then would be able to be distributed to employees that participate. I think, is that what you mean?
Yes, exactly. And somebody who needs it could.
Apply and it's divvied out by people that have some sort of position and.
I do think that was discussed at one point with CSEA, and I'm not quite sure.
I know we don't have that right now.
Right.
So the only way for us,
I wasn't, I think it has been discussed, but it never actually moved forward, is my understanding.
Yeah, we did that we're still doing it forever out to the sheriff's department.
People just donate.
They donate their
and then
leave.
when the leave comes up,
Absolutely.
and then if the bank runs out, you go back for another.
That's what we did when I was up there.
and in order to benefit from the leave bank, should you need it, you have to be a participant.
Yes.
I know that's how a lot of places do set things up, that we don't have that here. The only way for us to ask is to come forward for employee by employee to get permission to set up the lead bank. And then we would ask for donations for that particular employee.
And the conditions of how it works are set out in this resolution.
Correct.
Yeah. Christina?
So this lead bank will just service your particular department.
For this particular employee only.
Just, I'll say you're just looking for donations
For
of
this
time for
one.
this one person.
It's in this one particular
Okay.
situation right now.
Okay, I understand now. Thank you.
Anyone in the county could generally give some of their time.
Right.
But it's generally within the department that the time comes from, the donation, or it comes from at all.
I think that when there's a call out to tell people that there's an employee of the county that's in need of, lead bank hours, anyone can donate. So we could get some from anywhere, but then, yes, it's utilized in our department for that one particular employee. And if there's any extra time left over, it gets distributed back to the folks that contributed.
Okay. Any other questions?
I think I opened a Pandora's box, but
Yeah.
thank you for, did we do a motion to bundle?
Yeah.
If that was,
If I could get a motion for HH 1, 2, 3, 4, and then a second, and then we can do all in favor,
I'll move it.
any opposed? Okay,
Second.
all right. Anyone opposed to any of those resolutions? All right, great, thanks.
Okay.
Yeah.
The only thing that I wanted to mention that was on my report is put out the word to any of your constituents or folks that you know that may be eligible and interested in the child care assistance money that we have available for folks that qualify. We are,
Daycare?
yes, it's for daycare, essentially. They've changed the name from daycare subsidy to child care assistance.
Oh,
They've
okay.
rebranded it.
Yeah.
And the big change is that the income level for the parents who have children that need care has gone up from 200% federal poverty level to 300%. So the income that folks can earn has gone up pretty considerably. And it is,
What is the dollar?
It's in the.
It's right here on the back of the.
yeah, so like,
Yeah,
so
Sorry.
yeah, so a family of four that can have a income yearly level of $69,090 and still qualify. So this is gonna bring in a whole different group of folks that would maybe not have ever even known about this assistance program.
It was a family of three.
That's,
That's
okay, I'm sorry, so that's
69,000.
family three, yeah, family of four is
Four is
83,250, even higher.
So this makes it more accessible. for people.
Yes.
Okay.
Yep, for
great.
folks to be able to work and have, affordable childcare. So yeah, spread the word. There's gonna be some media stuff that gets put out by the state, but it hasn't come yet. And this started, it took effect August 1.
And there is, there is a push to try to get additional daycare providers too, because there's always. been
So right, there's the
shortage.
both sides to try to subsidize the
Yeah.
daycare for the folks that have children in care. And also to help pay the providers better so that they're more incentivized to take in children to care for them. So the amount that they're able to get paid has increased to have them fall more in line with the private pay folks. So they're more apt to take the child care assistance program, children that qualify through DSS.
Well, this increased, but when you say it increased, so say if a person that makes 40,007 has the children one, what is their participation in that? Is it 100% or is it percentage? Like, how much is the,
If you qualify, you mean?
yeah,
So I'm not gonna pretend to understand that formula, but because it's not as straight as, they pay it like some portion of a family share, but way less than, say the provider charges $225 per week for the child. They might pay $20, they might pay $15, depends on, the application, and there's a formula and things they need to plug in to get to the family share, but it is nominal.
okay.
Any other questions?
Thanks.
Okay,
Christine.
thank you, thank you.
Thanks. Good job.
Brenda, you have 3 resolutions, HH 5, 6, and 7, and we could kind of group those together because HH 5 and 6 to me, Brenda and I spoke about this. It really is moving the aid rate for ISEP from what was originally negotiated at $24 an hour to $26.40. And the HH6 is again asking for an increase in the respite aid rate from $24 to $26.40 because the vendor seniors helping seniors are making the case that they cannot afford to pay the lower rate any longer because of what they have to pay to get the aid service.
Correct, correct.
And
It's very similar to what we went to with another agency about 3 months ago.
And they have funding in ISAP and the respite program to be able to cover this, and we have a huge unmet need.
Correct.
Okay. HH7 is, from understanding, is to sign a contract with Arise for them to purchase, install, and remove 8 aluminum ramps. And you're using that unmet need money to do that,
Correct, correct. So this expands our ability to provide ramps.
right? Okay, so if I can get a motion for HH5, 6, and 7 and a second,
I'll move it.
Second.
okay? Any questions on
Second.
those resolutions?
Just a quick one.
Okay.
Any issues with the aluminum ramps?
I'm sorry.
Any issues with the aluminum ramps?
They are generally meant to be temporary and to provide an option until a more permanent ramp can be built. So when Jim Karasik from Arise was here talking about the ramp program that he's trying to build within the county, his goal is to get donations and develop partnerships with businesses and entities that would like to help him build permanent ramps for folks. Then they would remove the aluminum ramp, bring that to somebody else who needs it temporarily, and hopefully continue to build more permanent ramps for those that need them long term. So they're not perfect, especially with our winters.
That's where my concern is really.
Yeah. But Arise, this is what they do, and they have done for years, and they're very aware of that issue. So that has always been part of the plan. That the aluminums would typically be more short-term use.
Any other questions on those 3 resolutions? All in favor?
Aye.
Any opposed? Great. Now we're getting through the resolutions. Are you at anything you want to add to your report, Brenda?
Yes, we love our new space.
That's great. Okay, we have, to finish the resolution part, we have 2 mental health resolutions, and both were a little bit late add-ons, but both really were taking advantage of trying to fill some recent resignations of 2 staff. One, the health care manager is HH8. There is a resignation there because you have moved 1 employee up to help staff the mobile crisis. So it's left a vacancy in the mental health operation. And the other, you recently lost a full-time senior clerk, which does the front end of your services, and both you were hoping to not wait 30 days to fill.
Correct.
And see, these are both authorizations to fill current budgeted vacancies that in your department.
Yep.
Okay. Can I get a motion for HH 8 and 9?
Move it.
Second.
Okay, any questions? Okay, all in favor?
Aye.
Great.
Yeah, and my only update was that we hired a case manager finally for mobile crisis, and we did interview somebody for the social work position, so we should know shortly if we're able to get that person hired. So we can move forward with actually implementing the program, which
Everyone's been waiting for,
yes,
right?
everyone's waiting. So
And the sheriff again talked about the MAT. It's working
yes,
with
we're
you.
moving forward with that. We've talked about the state aid that we received and how we're going to kind of use that and possibly, what staffing they might need to implement the program as well. So it's moving forward. Hopefully, we're going to start with people that are already existing on MAT when they get to jail, and then move to new people and then figure out the methadone piece after that. So October 7th is the mandated date that we have to have that program up and running. So they just came out with the official guidance today that I received. So better late than never, I guess.
So for inmates that come in that are having a drug addiction, that have been on MOUD, you can continue it. And for those that have a past history, you could look to put them on prior to release so that they're not relapsing, and that kind of how it would
Correct.
go?
That every inmate would have access to it, but there's obviously, there's some things that have to be done before a prescriber is going to prescribe that,
Yeah.
meaning you have to document that they have an opioid use disorder.
Yeah.
And how
Yes,
they would
right.
need that medication. Yeah. Yep. All right.
Great job.
Thank you. All right,
Thank you.
okay. Kathleen, you have no resolutions.
That's a
Have a treat. Yes, it is.
For everybody. And that was so deliberate. I'm like, I can't wait till September. It's gonna. I just want to give a few more updates. There's a little bit of information of what we sent in that's rather seasonal. We're doing, you might have seen our most recent press release, last Friday, was first identified harmful algal bloom, reported to the DEC today. So we just sent out a reminder email about people to be aware and how they can report. I don't make light of it, but we're really in a better place than we were many years ago because people are so much more familiar with what they are, how you're supposed to identify them, what you're supposed to do when you see them, what you should not do when you see them. So the education is definitely working. Just a quick thank you to both Christine and Lauren. There were a couple different scenarios of situations we had. We had a housing situation that Christine's herself helped us significantly with. And I know, Lauren, just this afternoon, I was in the room when one of our coordinators in early intervention called you with a parent who was in crisis, and were very helpful. So thank you both. COVID clinics continue. I think last time I was here, there was some question about what our percentages. I just checked. The percentage of vaccination for COVID of the people eligible is 60.4%, according to the State Department of Health statistics. There is going to be some pediatric clinics for the very young children, the 6 month to 5-year-old, but 6 months to 17-year-olds actually. The East Hill and the Auburn Fire are hosting at the Auburn Fire Department on Friday and Saturday. So that's a great partnership, making it open to the whole community. We're just, CDC is supposed to be sending out some back to school guidance today. It's supposed to come out. Test kits are being shipped to BOCES around New York State, some rapid tests, so the schools can be prepared with that. But we anticipate there'll be some changes in the guidance for the schools coming forward. We've been
More restrictive or loosening or?
not as restricted.
I think the
Right.
CDC,
Yes.
just before we got here, released that they were changing and not focusing on quarantine anymore. So
Right,
I think
less
shift is
restrictions.
coming, yeah.
Great. We're doing a lot of back to school vaccination. We've set aside some very particular days just to try and get the children up to snuff with what their mandatory vaccines are for school. They have nothing to do with COVID. It's the MMRs, it's the polios, which leads me to talk about polio. I think most of you probably heard about the identified case in Rockland County. There is, I've been learning more about it too. This particular identified case, the individual does have paralysis associated with it, which I guess is 1 to 2%. The cases that are diagnosed, there are people who can have the virus and not really exhibit symptoms. They've seen in the wastewater in Rockland County and the towns impacted. There is poliovirus detected in wastewater.
Is it related to the monkeypox?
No, polio
itself.
significantly,
Yeah.
only on this one.
Mhm.
And it's really, it's a trend that's kind of happened over the last 20 years when we had, as a nation, eradicated polio and people stopped realizing the significance and importance of being vaccinated. And so there's also enclaves of communities who don't vaccinate against the common childhood and adult vaccinations and diseases. So hopefully this will be a lesson to everyone that this still happens. This is why we have childhood vaccinations, to prevent the measles outbreaks, to prevent polio outbreak. But the monkeypox certainly is a hot topic. Getting a lot of information every day. In New York State, I just checked before I came over here. As of this morning, there were 2,187 diagnosed cases. Over 2,000 of those cases, about 2,039, I believe, are in New York City. The rest are in counties outside of New York City right now. You saw that Onondaga County identified a case. We hope it doesn't come to Cayuga County, but it certainly can. And so we just stay apprised of all the information and we're ready to take action should we need to. I've been talking for way too long about 2020, 2021 statistical report. My goal had been to be able to hand it out to all of you today and then to the full legislature. It's not quite ready for that, but I think it should be before the end of the month. And I think it'll be a good reflection of the mandated services that we performed while we were performing our COVID activities during 2020 and 2021. We don't go into this year. We'll wait till the first quarter of next year to do it. But it's impressive and it's credit to our staff how much we continue to accomplish while taking on the burden of COVID. And those are my highlights. Thanks.
Thank you.
Thanks, Kathleen.
Anything else for tonight?
Whoa. I think we better.
Madam Chairman, I
Yes,
just got one thing.
sure.
I'm just reminding the whole committee that September, the way the days run, so the next meeting will be September 8th. It'll actually be before the other 4 meetings.
Oh, okay.
So just so everybody puts that on the calendar, it's
So we'll
September
do the
8th,
second Thursday,
right?
and that'll come before the rest.
The
of
other, yeah, just so everybody has it on their calendar.
We'll highlight it on our schedule. Sorry.
Okay.
Okay, if there's nothing else, I'll entertain a motion to adjourn.
Second.
All right.
Thanks.
What's today's date? August 11th. 30 minutes. Yes.
Put that in the notes.